There's been a lot of talk about healthcare disparities since the pandemic first hit. And while those inequities, like so many others, are certainly not new, we've been seeing more efforts to change that. Among them, a group of Boston researchers teamed up with local teams to help healthcare professionals better understand how those disparities function in the real world and how we might address them more effectively. I'm joined by three of those people behind the effort: Dr. Katherine Gergen Barnett, Vice Chair of Primary Care and Innovation and Transformation in the Department of Family Medicine at Boston Medical Center; Astraea Augsberger, Associate Professor of Boston University School of Social Work; and Osa Idahor, who participated in this project as a high schooler and is now wrapping up his freshman year at Harvard. Thank you all for joining me. Dr. Katherine Gergen Barnett, can you begin by explaining what is the reason you turned to teens in this effort?
Thank you so much for having us, and so glad to be here with my colleagues. So as we are very well aware, healthcare has long built on a hierarchy, and so we know that we need to really be reaching out to different voices. This work in particular was built on years of research where we had youth telling us, in order to change the system, you need our voice at the table.
So, Astraea, you helped set up the methodology for this study. Explain how it all worked.
Absolutely. So the project was a cross collaboration between Boston University School of Social Work and School of Medicine, and it was really aimed to listen and elevate the voices of youth of color in spaces where they've been historically underrepresented. So we intentionally recruited 8 youth of color between the ages of 16 to 25 from across Boston for an advisory board. And the advisory board model brings together youth to advise organizations on policy, practice, and research. And so the youth members were trained in participatory research methods where they engage in each stage of the research process, from design to collection to analysis to dissemination.
So one of the key things that you did was using photography, and you used a methodology called photo voice. Astraea, can you explain that?
Yes, absolutely. So throughout the year-long project, which occurred during the height of the COVID-19 pandemic, the youth examined the questions: what are individual and community perceptions of health, and what factors promote positive relationships between youth of color and healthcare professionals? And so the photo voice method is really a visual health assessment strategy. It's an empowering approach where youth take photos in their own community, and they share their photos with the larger group and critically analyze what they represent in the context of their own lived experiences.
So that's really, really fascinating. And we have Osa Idahor here, who can explain why he participated in this project and what he hopes to accomplish. Osa Idahor, what drew you to this?
I've always been interested in public health. I remember when I first heard about the project through a friend, I was like, oh, this sounds interesting. And, I had no idea, like, but it's almost been a year later or now plus, but just thinking about how much of an impact that this project is having and, could hope to have.
Well, let's put up the photo that you took. Can you explain? It's a collection of vitamin bottles, I think. What does this signify? What did you intend to say, or what was drawn from this by the group?
Yeah, this photo that I took is kind of representative of a theme of our photos. One of the themes was that, like, the resilience of the communities, taking health into our own hands. So, in the midst of the COVID pandemic during quarantine, there was a lot of uncertainty, people not knowing how to, stay healthy at home. Going to the hospitals wasn't really an option. So that photo was me just trying to, represent my experience and how my mom would often ask that we take all these vitamins before going to sleep, or regularly, just because, she felt, more in control of that.
And Astraea,
she was doing whatever she could to keep us healthy.
Okay. I think you froze there just for a second, but the role that you played in this youth advisory board, do you feel that it opened up a new way of looking at the healthcare community, at the medical community for you? Osa Seneca?
Oh yeah, certainly. I feel like just opened up like how I think of healthcare systems and reaching out to youth. I know we mentioned this earlier. I think that youth are often marginalized voices, and a youth advisory board is unprecedented in terms of healthcare. So being a part of this was something great to really think about making positive change in my community.
Astraea, is it possible to share the kind of conclusions, the major points that the Youth Advisory Board came up with?
Yeah, I mean, I think they came up with a collective narrative, which is really sort of the idea that COVID-19 is a revealing force that sort of highlights systemic inequities and the real need for moving forward to have young people at the table in making decisions around healthcare.
Katherine, some of this I look at and I say it seems very apparent that youth should be a part of this kind of mission, that youth should be contributing their voices. What is it about where we are in the healthcare system, in medical care, that it is still, that sort of the pool of knowledge, the authority is still held in the hands of a largely white paternal system?
Yeah, I mean, you're saying it perfectly. I think what is seems obvious and what has been true historically are two very different things. I think the silver lining, if there's been any silver lining of the pandemic, is that we're breaking open those narratives about how healthcare is delivered and recognizing that we cannot keep doing what we have been doing. We've seen that, the people who have been historically marginalized, including youth, have been the ones that have been most impacted by the pandemic. And we need to actually be doing things differently. We need to be bringing in not just voices and community engagement, but we need to change the power structure and the way that decisions are being made by healthcare systems. One of the things that I'm really thrilled about is that this pilot youth advisory board that Osa is part of and his colleagues who have been terrific, real path breakers for us all, is that Boston Medical Center has really taken note, and they've really been listening to these voices and now are actually going to be institutionalizing a youth advisory board at our hospital moving forward, and very much hoping this can be a model for other hospitals around the country.
Is this something that isn't really done in many hospitals? Katherine, do you have a sense of that?
Yeah, shockingly, it's very much the minority of healthcare systems that are doing these kinds of actions. We have a history of community health centers having patient advisory boards. If there are youth on them at all, they're generally tokenized as a voice. But having a youth advisory board that really actually has some sort of collective power and agency is not seen.
Astraea, does this represent any sort of shift, bringing the role of social science into how healthcare and medicine is delivered? Is there a shift there that needs to happen, or has this already been going on?
Absolutely. I mean, I think the shift is happening. I think that many researchers are aware of the need for all voices in research, and the participatory research methods really are sort of centered in engaging participants, community members throughout the entire research process, so that we're partnering in identifying priorities as well as solutions.
Osa Seneca, a lot is said about a lack of trust between communities of color and major healthcare institutions. Do you think that youth advisory boards can play a big role in restoring that trust or building trust? I shouldn't say restoring, because it historically hasn't been there, in building that trust.
I think there's a lot of potential, and you mentioned it, that that trust has historically not been there. So youth advisory boards are an important, not just performative. We talked a lot in our group about performative actions, and it doesn't feel like this is something that can just be so performative when you actually give people a chance, ideally to show that they have ideas about how they can positively impact their community through bringing awareness to health issues.
That's an important point about not just being performative. Katherine, can you help explain to people something concrete that a teen advisory board might move the needle on? In terms of, for example, COVID immunizations, reaching the community, ideas to reach a community. Are there specifics where you already know that something like this could move the needle?
Absolutely. I mean, one of the things that we think about all the time in healthcare is what is the message that we're giving, and is actually that the message that's going to hit the target audience? So having a youth advisory board, actually you can work directly with the experts and say, is this what you think the audience needs to hear, and how would you do it differently? And then actually creating campaigns around that. Another opportunity, obviously, is we're in a mental health crisis, and we know that that's deeply impacting youth and marginalized communities and truly everybody. And how are we actually going to be bridging the resources that we have in places like hospitals and community health centers with what communities need? And we need ambassadors, and we need voices that have the wisdom, who have the lived experience to be guiding us.
Astraea, do you see that this could be built in other ways for other hospitals off the model that you have created?
Absolutely. I think that this was a pilot. We had limited funding, and the young people then brought their recommendations and their findings to Boston Medical Center and said, this should be institutionalized. And I really believe sort of in the best practices that are we need to evaluate the best practices and then think about how they can be disseminated more nationally.
Osa Idahor, do you think this will shift viewpoints among youth of color, that this really can move the needle, this kind of involvement? Do you think that it will be empowering?
I think so. I think it has like I said, there's a lot of work to be done. And, in the early stages, it might feel like, it shouldn't discourage us that there is so much work to done. It's work to be done. And I think that this has potential. It's all about, being intentional with who we put on the board and, the work that we give them. So, yeah, I'm excited.
All right. We have to leave it there. Thank you very much. It's really fascinating work. Thanks.
Thank you.
Thank you.
Thank you.